Time now for Restoring the Soul of Healthcare from the Help Care Clinic in Austin.
It is that time, our once a month get together with the Healthcare Clinic. Lee Acey not on the phone today, actually joining us in person. Always good to see you.
Yeah, really glad to be with you in person, and then also to welcome a guest with us
Yes,
today.
you have a very special guest with you. No stranger to the airwaves here, but good to see Elaine Hanson, President of the Austin Area Chamber of Commerce. And something very, I think, exciting, new that the Healthcare Clinic finding ways to just keep bringing benefits to people in different ways. And that's kind of the topic for today.
Yeah, we're all about innovation and providing care in a way that's both more affordable and also more personal, more consistent, and just something where people can go to the doctor and not have to worry about what the bill is going to be, that's included in the membership. And we include a lot in that, in the membership. So more than 100 blood tests. The appointments are no charge for the appointments. A couple prescription medications. What we haven't had so far is how do you connect that to the health insurance system, and especially the employer-based health insurance system, because we don't want it to be just an extra expense for those employers who are wanting to maybe include this as among their benefits. Well, we're excited now that we've got a health plan involved with North Risk Partners as an insurance broker, and they've developed a plan that enables us to include healthcare clinic membership as one of the features of the health plan. It actually reduces the cost of the health insurance for the employer because they're getting their primary care from us as at a lower cost and in a more consistent way. And so we're excited that Elaine and the chamber are excited and that they're helping us spread the word on this.
Yeah, as a matter of fact, I asked Elaine before you came in because I've heard your ads here on the air talking about a special event coming up where people can get more information. So maybe we should kind of talk about that.
Yeah, absolutely. We are really excited to work with our partners and members. And one of the big things so many of our members, especially the small businesses, ask about is, gosh, what is there for an option for healthcare? Because it is expensive and yet it's a benefit so many employees are looking for. So in helping small employers attract and retain employees, offering more benefits is a huge plus. And so as Lee came to us and told us about this, the healthcare clinic itself is an amazing experience and it's wonderful for people. But now they've expanded it, to really make it truly a healthcare option for an employer to offer to their employees. It's exciting. So we're working together and we have a big event coming up on Monday, September 18th, 10 a.m. at the Hormel Home. And Lee can share more about that event and what we're going to talk about.
Yeah, well, we're going to start with just an introduction to Healthcare Clinic and how that actually solves the primary care problem, that a lot of people are experiencing. And we've grown to more than 700 members now, in Austin, and so it's gotten a good reception. But then we're also going to be introducing our friends from North Risk Partners to talk about not only how they use they use us for primary care as a way to reduce the cost of insurance, but also some things around drug reimportation from Canada and from New Zealand. So some of those things for the really expensive drugs, they can really cut those costs, and then just other levers that they can pull that can, when you combine them all together, it can make for a much better package for the employees because they actually get the health care. Because the problem with health insurance, when you pay thousands of dollars for it, typically, is that then you have a $5,000 deductible or a $7,000 deductible. And so the employees just don't go to the doctor because it's all going to be out of pocket anyway. And so they're paying thousands of dollars and getting no health care. And now they can pay less and actually get the care. So we're excited about being able to...
You're actually using what you're paying for rather than avoiding it because you don't want to pay more.
Right.
Yeah. It's really cool because I just was thinking about that. Is that I think in getting back to when we very started these programs, talking about what you're doing, is you and all the partners you've kind of gotten with along the way, just knowing healthcare doesn't need to be that complicated and just looking at it from a different view and finding ways that you can actually lower the costs and still provide everything that you were getting before.
Yeah, it's kind of a combination of innovation, looking at things in a new way, but also looking at, we used to do things back. I mean, I used to go to Dr. Herman Miller when I was a kid. Okay, I mean, you had a doctor that you knew and a consistent, experience, and so there's something good about that part, and something that's kind of been lost as the doctor's offices kind of all got swallowed into the bigger
Yeah.
healthcare system, and now if we can kind of turn back that clock a little bit by then adding this new wrinkle, I think it could be a big win for everybody.
And in your role looking at the business community, I would think this would help with not only employee retention, but also business retention. That if you're trying to come to Austin, you have this option available. It really could help your bottom line as a business, both in helping recruit people to your business, but also what you're out of pocketing.
Yeah, it's very exciting, John. And one of the great things about working with the healthcare clinic is that those employees will have those health needs, concerns met sooner. So it means less time off work, right?
Mm.
So if you deal with those things up front, and so, in terms of workforce development and keeping people at work, it just seems like a great opportunity. And so we're really excited to partner with the healthcare clinic to push this information out. It's not for everyone, but having another choice.
Mhm.
And that's really what it's about, is helping to figure out how to improve workforce in our area. So that's why the chamber's really excited about it and what it can mean, working with a member and bringing services to our community.
For the event on the 18th, do you need pre-registration, or is just come as you can? Or
Well, we strongly encourage people to register. So if they go to our website, it's the blog post that's up today,
Mhm.
but we also, if you go to healthcare.health/employers, if they want to give us a call at 507-279-2345, we can get them, information on it as well. But the chamber has an event sign up on their website as well. So we link to the
Sure.
chamber site. And we just help us plan for who's going to be there, so we can have the appropriate light refreshments and all.
And
Well,
materials.
handouts.
And materials and
Yeah.
handouts and
Yeah. And our website is austincoc.com. So real easy. And if you have any questions, you can reach us at 507-437-4561.
We talk about your website and the blogs, and I find them very interesting, great information. And some of them are just, it's not always just about healthcare. It's getting information to people that they can use, whether you're part of this or not. Social media is such a wonderful thing. And in just the last couple of weeks, I've been seeing more and more people chatting about the healthcare clinic,
Mhm.
which I hadn't seen before. And the things they're saying are so complimentary and over the top. They were like, why did it take so long to find something like this? And that speaks volumes of what you're doing. It's pretty cool.
Yeah, it's super gratifying. I mean, the Eat, Drink, Shop Austin, there was a nice conversation about it, and it was
Mhm.
so neat to see a lot of our members jump in and say, "Oh yeah, that's where I go, and I love it." And yeah, we're trying to create that really remarkable experience, and then the good thing is that people remark.
Yeah, and going into detail as to
Mhm.
the why. And that's, I think, what people are kind of missing in this. They say it sounds like a good idea, but does it really work? And when you see these testimonials like that, you're like, man, hey, check that out.
Yeah, well, I encourage people to check out on our website. We've got member stories. So we've got more than 25 of our members who
Mhm.
have said, "I want to tell my story publicly," and they either
That's cool.
we either did a video with them or they wrote something out, and so that's a pretty nice percentage of people who are already just it's talking about a private thing. It's about their healthcare, but they've said, "No, I want to talk about this because I want other people to know."
Yeah, that is really awesome.
I,
Uh,
I just had to throw out,
yep.
I'm excited because Austin Pride, this is Austin people, Austin natives who have started this and bringing it back to the community. So kudos to you for recognizing this is a place to make things happen.
Well, thanks. It's our hometown, and we want to serve our hometown for sure.
Yeah, and we do this once a month now, so I really want to get the information out. If people want to get a hold of you, find out more, just what are some of the resources they can get to?
Sure, they can go to healthcare.health. That's our website. And as you said, it does have a lot of information about general health and just for wellness for people who aren't members. But for those who want to consider becoming a member, give us a call at 507-279-2345, or they can stop and see us at 308 4th Avenue Northwest. So the meeting that we're having on the 18th is just a block from where we are.
Yeah, we got just a minute. Let's just kind of recap that meeting and get people signed up for that.
Yeah, just encourage people to sign up at the Austin Chamber of Commerce website. It's the September 18th. We're going to be having a meeting to talk about how all the benefits of healthcare clinic membership can be part of an employer-based insurance program.
All right, very good. Elaine Hanson, good to
Thank-
see you. Nice
great to
having you
see you.
out here, and this is going to be a great benefit for Austin. Lee Acey, always a pleasure to talk to you. We'll check in with you about a month from now.
All right. Thanks, John.